All right, welcome everyone to the PRESSBOX here at IMSH 2022. My name is Lance Baily. I'm the founder CEO of HealthySimulation.com. We are putting together for the first time ever this amazing PRESSBOX opportunity with SSH in partnership. So as you can see, it's shared by both groups. We're working together to try to create content to help those that perhaps could not make it to the event this year, or to kind of better understand what's happening here at the showroom floor, to record these sessions and make them available to you at home, wherever you are. So very excited about the lineup of over the next 3 days. We have about 2 hours during each of the exhibit hall sessions to kind of really focus on various specific panels, discussions, interviews, presentations, covering a variety of topics that'll be really helpful to you who are engaging with healthcare simulation to either improve education, training, or patient safety outcomes. So today's first session is going to be about the impacts of COVID-19 on the healthcare simulation space. We're going to get started with a survey results that HealthySimulation.com has put out to the general public over the last 6 months to better understand how COVID has impacted our programs in various different capacities. SSH also has some COVID-19 survey results in terms of an industry-wide survey. They're going to be releasing those results, I believe some of them here at the IMSH 2022 in Los Angeles shortly, and they're going to go ahead and get those out to you as well. But for here today, we're going to just talk about the survey results that we found from HealthySimulation.com in order to help you better understand about what's going on in the space for others, so that we can all kind of learn and see what kind of impact this has made to each of us and to our programs as a whole. Hi, how are you all doing? Hey, how are you? Yeah, come and sit down and watch. We're having. Yeah, come crashing. So we're talking about the impacts of COVID on the healthcare simulation industry with a survey from Healthy Simulation that we just put together, and we're going to share the results here. If you'd like to, you can bring up the presentation that I built for this. It's at bit.ly, everyone, bit.ly/COVID Sim Survey. That's where we've got a mini presentation of slides of the kind of content that I'm going to be sharing with us all here in terms of this survey results. So bit.ly for bit.ly, and that's /COVID Sim Survey, helpful to kind of check out what's going on there. And with that, we're going to go ahead and start to take a look. So we had over 130 respondents for this survey from all over the world, and I'm excited to say that we did offer for some individuals the opportunity who completed the survey to win an annual subscription to the new HealthySimulation.com Learn platform, where we have a lot of our CE webinar and course content available. So those winners are Catherine Ross, who's an RN and health lab technician at Pearson Adult and Career Center. Congratulations to Catherine. And to Diane Carius, PhD, CHSC, or Certified Healthcare Simulation Educator, and the Director of the Simulation Program at Kansas City University. So we'll be sending out notifications to them shortly about their winning, and they're going to get access to the Learn platform for the next year for all the courses that we've got, or excuse me, all the webinars that we have available already, and all the new webinars that we'll have up and available to us in the near future. So that's being said, let's go ahead and take a look at some of the results that we're seeing from this survey. So first thing we asked everyone was just to kind of get a better understanding about the types of individuals that are working in clinical simulation that submitted to this survey. How many years have you been working in simulation? And we had about 42 respondents, or about 30%, said that they were working for over 10 years. Another 23% said that they were working for between 6 and 9 years, and another 30% 3 to 5 years. So to me, that's quite significant, because obviously to have experience in the clinical simulation industry right now, or the community, is quite rare. And so to know that we had somewhere around 80% of respondents who have either 3 to 10 years of experience, pretty exciting to know that we've got kind of a more advanced community, with certainly over 50% of respondents saying that they had 6 to 10 plus years of experience in the simulation industry. The disciplines that these individuals represent in terms of their simulation programs: nursing students were a part of the representation. 64% said that they also did for nursing students, and 40% for nursing professionals, 27% for medical students, and 25% for medical residents. And then allied health students, 30%, allied health professionals, 22%. So I think that's really important. You know, this was a checkbox, so you could have any one of those learners as be a part of it, but certainly we're seeing across the board that nursing makes up the majority, then medicine, and then we have allied health behind that. So if you'd love to follow along, again, that link is bit.ly/COVID Sim Survey. So really easy to kind of check out the little presentation that we put up there about these specific stats there. Next question is, did your in-person simulation labs close due to the pandemic? So here we go, getting started with some of the content that we're doing over here in terms of what's going on specifically with COVID. So the majority of individuals said yes, they did have some kind of closure of their simulation programs. 18.5% said that they did not. The rest did to varying degrees, with 6 months being the most. Over 30% closed for 6 months. And then we had over 15% at 12 months, and yet another 10% closed for over 12 months. So certainly there were a lot of simulation labs that were completely shut down for a number of months, and I'm sure that that had an impact on their ability to provide clinical education and training during those time frames, right? So next question, our simulation program upgraded or remodeled its physical lab spaces during the absence of learners during COVID. So our simulation program upgraded or remodeled its lab spaces, right? And so I think what's important to note about this is that it was taking place during that time when the learners were out. We had over 37% said that they agreed with that statement or strongly agreed, and so that they did have an opportunity to take the COVID timeframe where their programs were shut down and remodel or upgrade or update their spaces, right? So at least, if nothing else, we had an opportunity here to help kind of remodel and redevelop our simulation lab spaces in a way that would help them to achieve better outcomes overall. And then there was about 50% that said no, they were not able to. And of course, for obvious reasons, perhaps it was very difficult for them to be able to achieve any kind of hiring contractors or just get approval during this crazy and chaotic time. But I do think that it's interesting to note that 30% of those 130 respondents were able to remodel their simulation programs during this time frame. The next question, our simulation program has significantly increased its ability to provide remote learning opportunities because of COVID. So during COVID, did your programs increase the ability to provide remote learning? And we had a strong increase in this. We had almost 67% of simulation programs over the last 2 years have significantly increased their ability to provide remote and distance learning opportunities. I think that's very telling in terms of ripping off that Band-Aid of exploring some of these technologies and integrating into the program, enabling for them to continue to provide clinical education and training opportunities. So almost 64% said that they did, right? And so, I'm under the belief that we have this technology adoption cycle, and that we here are right now somewhere in the early adopter phase of that technology adoption schedule. And in order to get to a place where we have full adoption, right, we've got to have people that are willing to participate at every level of investment in simulation. And so there's a lot of resistance to simulation for those folks that maybe have not had the opportunity to experience or to work with simulation before, but because of COVID, we no longer had any alternatives. We no longer had the opportunity to maybe pass off on a simulation experience. We needed to find solutions. We saw that a great 30% or more were looking at ways of providing for this, and so it just really, I think, is telling that that did happen, and that those kinds of technologies are now found themselves in these clinical simulation programs around the world. Next question. Our clinical educators and trainers have a more favorable view of what our simulation can offer following COVID. Massive here, absolutely massive. We have the 70% said that they agreed or strongly agreed that their clinical educators have more favorable views of what simulation can do, right? So now we have simulation programs, in my view, that have demonstrated the ability to handle chaotic situations, utilize technology for meaningful outcomes, track that performance, and showcase what kind of success can happen when you make an investment in simulation. Not only in terms of ROI long term, but also the ability to see that the simulation program is making a difference, right? And so absolutely, I think this is a really telling statistic that 70% of groups are having a more favorable view from their clinical educator community that are potentially going to utilize that program, probably more so now in the future than before. So let's continue that question on to the next one. Similar question, but this time, institutional leadership. Presidents or C-suite executives, deans, for example, have become more aware of simulation program and its capabilities since COVID started. And, do you agree, disagree, strongly agree? And we have 70% strongly agree or agree that presidents, C-suite execs, and deans have a more favorable view of the simulation program following COVID now than before. And I think that is extremely telling with regards to the influence that simulation programs can now have moving forward now that they're a known entity within that institution, right? And you think about it, to me, it's just like, of course, we were quite well positioned to be able to help to mitigate some of the issues and challenges of COVID. We are people who are comfortable taking risks. We're not afraid to fail. We are willing to invest in new technologies and see how those things can unroll. We're comfortable being champions for simulation-based technology and selling the ideas and the concepts and the potential of those things. And we are already in a position, a place where we know that the things that we do can and will make a difference. And so now that COVID has happened and we have more awareness from C-suite execs and presidents, I think we're going to see continued investment in simulation, further considerations for the ways that simulation can make impacts to those institutions, even beyond COVID. I think it has a lingering effect that will continue to apply as market penetration continues to grow to that 100% technology adoption. This has been a major milestone from what I can see here with helping to make an influential impact with regards to awareness for our campaign, for our programs, right? Okay, next question, continuing from there. After COVID, the remote learning capabilities will remain a key consideration for all of our future simulation technology purchase decisions. So when we're talking about hundreds of thousands or potentially even millions of dollars, how likely is it that these group of individuals will be specifically looking for remote learning capabilities? And you guessed it, folks, we have 74% of groups that either agree or strongly agree to that statement. And so to me, that means that remote learning technologies have made an impact, they have shown and demonstrated value, and these groups will continue to consider ways that they can bring these technologies in to make those improvements over time. Very, very exciting. I think that that says a lot for things like XR technologies, virtual patients, distance-based learning technologies, on and on it goes. So from there, we're going to continue on to our simulation program spending per learner increased during COVID. Did it increase over time, right? And so the majority of folks said that we had about 46%. Hey, have a seat, join us. We've got a few minutes here. We're going over some presentations before we move on to the next session with Lynn Welch and EMS, but right now we're going through a COVID survey. Y'all can follow along with a special link if you want to see the presentation stats as they come out. bit.ly is the link /COVID sim survey. Our simulation program spending per learner increased, and we had 46% agree or strongly agree that yes, it did increase in terms of simulation spending per learner during the COVID phase, right? So we did have about 31% that said no, it did not, and then another 20% or so that said absolutely did not. So they were neutral, maybe it was about the same, and about 40% said no, that did not happen. But I do think that it's telling that almost 50% said yes, they did increase their spending per learner. So let's now we indicate, ask them to indicate the modalities of your simulation program which were invested in the most during the COVID phase. And so the one that, there were a lot of groups that did not make any investment in any of those unique technologies, but a lot of groups made up to a $10,000 investment in a full range of different technologies. Everything from blended learning, take-home skills trainers, new audio-visual systems, mixed reality, augmented reality, virtual reality, and desktop screen-based patients. So certainly I think that a large number of smaller investments were made into into all of those key platforms. I will say that augmented reality was the least, and that desktop screen-based virtual patients was the most. Following that, we do see smaller numbers of investment, but larger investment amounts, ranging from $10,000 to $25,000, $25,000 to $50,000, $50,000 to $100,000, or $100,000 plus. The systems that had the most investment in the highest amount of the $100,000 plus were new audio-video systems. And this makes sense, right? Because audio-video systems require a lot of hardware. it's very expensive to kind of invest in integration and making sure that all those systems are going to work the way we need them to, recording technologies, and then on top of that you have the learning tools, or the LMSs, if you will, that are helping to manage that simulation program management overflow. So we still saw plenty of investments ranging in all those different prices in desktop screen-based virtual patients, virtual reality, augmented reality, mixed reality, and take-home skills trainers. Not so much in the $100,000 range for the skills trainers, but certainly investments being made at around $10 to $25,000 consistently. Lots of investments being made at the $50,000, $100,000 range for virtual reality, and for, looks like, mixed reality or blended learning opportunities. Okay, so pretty telling about kind of the budgets that were invested into these different types of technologies over the past 2 years. Next question, the remote simulation technologies we invested in to combat COVID are more cost effective than the way we previously taught the same material. So, has this been better, about the same, or worse in terms of how we used to do things and these new technologies that we've invested in? 35% said that they agreed or strongly agreed that these new technologies were more cost effective. 48% said that they were about the same, and about 15% said that no, they were not as cost effective. So we need to kind of dig deeper into understanding a little bit more about why that is. We've got a couple of text boxed answers coming up here that we'll highlight to kind of cover why maybe some of those groups did find greater cost effectiveness. Many found it to be equal, which I think, you know, is still a positive, because it means that wasn't more expensive to invest in these technologies. It was either at or better for the majority of them. Pretty telling. Next up, we've got, because of COVID, resistance from institutional leadership to purchasing future simulation technologies has reduced. Okay, so that's an important number. How have we been able to convey the importance of these technologies to our administrators when it comes to making the investments into simulation? And you'll be excited to hear that we had 42% of groups, so almost half, said that the resistance has been reduced and that institutional leadership are more willing to make investments into simulation-based technologies. About 30% said it was just the same, and 25% said that no, it has not yet made any difference to those programs. So I think it's kind of telling that we had the majority of groups saying that the resistance or the barriers have been reduced, and we're going to have, in my mind then, more willingness to make investments in these technologies, which can lead to great outcomes. Next up, our spending on simulated capital equipment / capital systems has increased during COVID. So those large capital investments, maybe, you know, the higher fidelity mannequins, the audiovisual systems, the LMSs, whatever it is for that, you know, larger capital equipment purchases. And we have 47% of groups saying yes, that they did increase their spending on those during COVID. 27% said neutral, it was about the same as what they were doing before, and about 23% or so said that no, they did not. So the majority being yes, I think that's pretty telling that we're seeing that groups did make investments, and that those investments, you know, because of the other stats that we shared, are making a difference, and that people are appreciating them and taking notice, and that they're making an impact. Continuing in that same vein, remote learning investments will continue at our institution even after the COVID pandemic ends. Whenever that is, who knows anymore. Remote learning investments will continue at our institution even after, and we had 57%, it looks like, said yes, they're going to continue to make investments into learning investments into the institution even after the pandemic comes to a close. Only 17% said no, they were not. Okay, so please. Next one. We'll skip that one. Okay, the remote simulation technologies we invested in to combat COVID improved learning and training outcomes over the previous ways that we trained the same material. So now, are the technologies that we invested in better in terms of reaching those training outcomes than previous ways of doing things, which I would think probably involved more brick and mortar interactions? You'll be excited to hear that we had about almost 40% said yes, that the remote distance simulation technologies invested in are actually providing for better training and learning outcomes overall. 44% said it was about the same, and we had about I'd say 17% or whatever is left over saying no. So I would still say, while it's not necessarily half, I would say that a lot of groups found that they were either at the same level of outcome performance or better. And I think that's very telling for what's to come down the pipeline for our simulation programs with regards to continued investment into these spaces over time. So we asked them, follow up, are you satisfied or dissatisfied with the simulation technologies your program's invested in? I'll just read some of this, the quotes that came from there. Remote distance technologies offer another way of teaching and learning, greater flexibility. They are easy to use and easily accessible for students, so democratization of access, I think, is a really important point when it comes to talking about these things. We've invested in new technologies but did not provide enough training for involved staff to use them. That brings us to why it's so important to consider things like SimGhosts or SimOps to ensure that both clinical educators and technical staff are proficient with these technology standards, right? And how do you best implement them and adopt them? Something that really has to be considered. Just this past week, healthysimulation.com engaged in a webinar with some of the members and leadership from Anaxel on the new standard for their standards of simulation best practice, where they shared about professional development and how important that is. It's a new standard, just came out this past quarter, and so certainly if you're interested in checking that out, you should definitely just search on learn.healthysimulation.com. You'll find it, and a really important caveat that I think is really important for us to be considering in the near future. Okay, so someone's saying here, it was time to upgrade our simulators, and we did, and we love them. However, now the new equipment makes our old equipment look shabby in comparison. Well, that's going to be a problem for all of us, no matter the time or place. And that's the thing, folks, you really need to remember that simulation-based technologies, just like any other technology, it has a shelf life, right? No one is using an iPhone 1 anymore. It's obsolete. Maybe my dad is actually, but for the majority of us, and that's the thing, we have to kind of consider and be ready for technology refresh cycles on a regular basis. We stayed more in person than I would have expected or preferred. Okay, some people saying they wanted to go to remote, but they weren't able to. And one of the problems they faced was that learner computers were not all the same, they weren't standard, and so that caused some challenges and difficulty because gaining access to these tools was limited in their ability. All right, let's look at a couple more, because I know we're almost towards the end of the survey results. The machines that we invested in definitely filled the need very well, and there was no issues that ever needed resolving. And let's just see one more. We've been doing remote sims prior to COVID, and we've been very satisfied with those results so far, so we just continue to expand them out there. Plenty more of these types of quotes. We'll try to make some of these available to you, and I think that will be helpful to you all. Next, we're almost towards the end of the survey here. We are all satisfied with the new clinical simulation technologies we invested in during COVID and will recommend them to others, and we found that 58% of respondents said yes, they were satisfied with the new clinical sim technologies and would recommend them to others, right? So it sounds to me like with all of these results that people are making more investments into simulation-based technologies, getting better outcomes, and they're making an impact in terms of bringing more awareness and support from their institutional leadership. Really excited to hear all of these things. We had an assumption, but we wanted to put the survey out to confirm what we were hearing from individuals and from different institutions, and it seems confirmed from a lot of what we've been seeing here. So we'd ask people specifically, share with us a few sentences about how COVID has made a lasting impact in your simulation educational program. The simulation team produced interactive learning simulation activities for the students, and some were synchronous and others weren't. This increased utilization of our simulation program, opportunity to consider different modalities and reconsider use of others, change the reliance on simulation and increased respect and need for simulation by change that reliance, increased it. And let's see what else here. There was a push needed to upgrade spaces and systems as well as teaching techniques that was met by administration, and it made a difference for us. It brought the importance of PPE training, donning and doffing to light, knowing we can do that with a virtual learning environment safely, provided really good outcomes. Very cool. Well, it seems like a lot of groups are saying here, that it was impactful and it was meaningful to them, right? So that pretty much wraps up the survey results. Really excited to see about what happened there. I think it's very telling that those things are there and that they made a difference for all of these programs. I'm sure we're going to be seeing more about XR technologies, including mixed reality, virtual reality, screen-based learning, hybrid training in the future because of COVID. It has made a difference, and so certainly important to consider where your institution fell on that and what it should be considering compared to others in the space. So with that, we'll end this session and look forward to seeing you at the next one.